Yeah, yes, sir. We are fine. Yeah. Good afternoon. You can start it, sir. Thank you, sir.
Okay. Thank you very much.
Okay. Yes. I think we can start. We are on the 2 o'clock line. Typically, we give a 1 minute courtesy. So I think we can spend 1 minute. Good to see you, Sujata. I think is Professor Nitya also there.
Good afternoon, sir.
Good afternoon, and
Good afternoon to everyone.
Yeah, good afternoon, Satish. Good afternoon, everyone.
hi, good afternoon. And I think Professor Parsarthi is also there. So
Good afternoon.
yeah. Of course, Professor Parsarthi and Nitya know each other, but I think Sujata is Additional Chief Secretary of Government of Maharashtra, but her being here is on account of her experience in situations of conflict and disaster. And she also has some considerable experience on COVID-related handling. So that would be a good combination today. So let's look forward to that.
Good afternoon, Dr. Rao. Pleasure to meet you.
Yeah, good afternoon, Sujata. Real pleasure to meet you too.
And Sujata, Professor Parsarthi is from Humanities and Social Sciences. So he was earlier heading that, then heading climate change. So we keep seeing him as head of something or the other. But he has a huge experience.
Good
afternoon.
So Professor Amit, I think since we have crossed the half a century in terms of participants number, we could begin.
With 2 minutes extension, I think. So we can probably begin now.
Yeah. And many participants, since they have problem with Zoom, they will be on YouTube. This is being live streamed. So just for information of the speakers. So please go ahead.
Okay. Thank you very much, Professor Agnihotri. So warm welcome to all of you on day 5. All eminent speakers, our moderator, Professor Parsarthi, and all the participants. So today is day 5, and today's topic is essentially going to be concentrated on disasters, food and nutrition security in pandemic, war, and conflict. We have 2 eminent speakers. Our moderator, Professor Parsarthi, will speak about them, present their bio. I welcome Professor Parsarthi to moderate today's session. He is, as Professor Agnihotri did mention, that he has immense experience in different fields. But in today's context, I think what we also need to appreciate is among many research areas that he has delved into, development studies and disaster studies are something that Professor Parsarthi is heavily involved in. And this is, I think, right up to his alley. So he's the right person to be able to moderate this session and extract all the insights from Professor Rao and Sujata ma'am's lecture, and we'll be able to, I think, understand it better in his presence. So over to Professor Parsarthi. Floor is yours. Thank you.
Thank you very much, Amit and Satish, for inviting me to chair and moderate this session. I'm very happy to be part of this session. As both of them mentioned, I have done some work on food and nutrition security and some work on disasters and conflicts as well. And last year, I was part of a small group from IIT and the Tata Institute, and also the Kamla Raheja Institute in Bombay, where a few of us actually did some small studies on food and nutrition security among marginalized groups, and we published this short set of articles in the Scroll. So, and of course, we have a few students who are working on how COVID-19 pandemic and the lockdown, so that the government response as well, affected food and nutrition security among especially marginalized groups here in Bombay and other places. And of course, Nitya and I are working on a project where we are looking at small-scale fisheries, artisanal fisheries in both the east and west coast in India, in selected districts. And we've seen for ourselves how the pandemic and the lockdown have severely affected food security among groups where it was not such a significant issue as it was, as it is for many other groups. And of course, the gender aspect is very important because men and women play different roles in ensuring access to food and ensuring household food security. And therefore, it's important to find out how the differential impact of a disaster on gender roles and the ability of men and women to access and food and provide food security to their families, especially children, is something that's very important for us to learn more about. So I will not take away too much time from the two speakers. So I would first like to introduce Ms. Sujata Sonik, and then we'll have her presentation to be followed by about 10-15 minutes of question, answer, and discussion. And then we'll go to Professor Nitya Rao. And then finally, we have a third speaker, Ms. Kushbu, I think, in today's session. Yeah. So Ms. Sujata Sonik is an IAS officer for the Maharashtra cadre. She's also been a Takemi Fellow at the well-known T.H. Chan School of Public Health at Harvard in 2018. And she has also been a fellow at the Middle Asia Institute working on issues related to public health, climate change, and disaster management. Among other themes and topics, her research has focused on insurance-based healthcare models in Maharashtra. And as part of her work, she's also worked on skill development, employment, and entrepreneurship, as well as something of relevance to today's talk on public health and financial reform. She's been a part of two government related projects with the Oxford Policy Management Study on women and child and school education. And this is something that she's worked on at the national level also on women and child and disaster management. So she's somebody who's very eminently suited because of the work that she has done in the past few decades on the topic that she will talk about today, which is on food and nutrition security during pandemics, disasters, and conflicts. Over to you.
Thank you very much, Dr. Parthasarathy. And a warm hello to all the participants who have joined from different parts of the globe. Indeed, it's an honor for me to be addressing you on this very important topic. I must also mention that I was part of two United Nations missions. One was to Cambodia after the fall of the Pol Pot regime. And I was part of the team that conducted the first democratic elections in the country. And secondly, I did a mission in Kosovo after the fight with the Serbian government, and led the civil administration component in 3 municipalities. And I worked at the National Disaster Management Authority of India, which is the apex body for preparing disaster management plans for the country, and is the lead implementer of the National Disaster Management Act. So with this background, I will make a small presentation. For the ease and convenience of all our participants, I have put some efforts into creating text forms so that you can all follow what I'm saying. And there will be also a short video in between, so that, I mean, there's an interest of my own that I would like to keep this material with me for future use. So now I will start my session by the opening statement, and I'm going to share my screen so that you can see this one. Yeah. Is it visible, Dr. Parthasarathy?
No, we are not able to see the screen yet.
Just give me 30 seconds. Share file.
On the share option, are you able to see your screen, Sujata?
Yes. Just 1 second, sir. This is an Apple desktop, so you know this always.
Oh.
Just give me 30 seconds.
Yeah, sure. So it's a hardware to hardware translation.
Yeah, it is always Apple.
If you have shared with us, shall we project it and then you could talk? That's also another possibility.
Yes.
Can you see now?
No. One thing you could try is to try opening the file from share. That option should also be available.
Let's not spend more time.
Yeah.
I shall in any case start and we'll figure this out. So I would like to begin by saying that global food and nutrition security have a history of more than 50 years and has evolved through a sequence of definitions and paradigms. This transformation involved following phases: food for development, food as an assurance, broadened food security, freedom and hunger malnutrition, and food and nutrition security. The nutrition dimension to food security came into existence because food security does not spell out actual food consumption, but simply access to food. This concept emerged in the mid-1990s and was part of the Millennium Development Goals, formalized later on in 2012. The World Health Organization is working on new food systems for health narrative with 5 major pathways through which food systems impact health, using a One Health approach. Now, what is this approach and what are the 5 systems? I'm going to mention them one by one. The first is unhealthy diets and food insecurity, which impacts including overweight and obesity, undernutrition, micronutrient deficiencies, and diet-related non-communicable diseases. The second is zoonotic pathogens and antimicrobial resistance with impacts through farmed, ranched, and wild-caught animals. Third, unsafe and adulterated foods, including those containing hazards such as pathogens, chemicals, and toxicants. Fourth, environmental contamination and degradation through pollution of soil, air, and water resources. And fifth is occupational hazards, including harm to physical and mental health suffered by workers in the food system. This mention was in the Director General of WHO's opening remarks at Healthy Food Systems for People, Planet and Prosperity at the UN Food Systems High-Level Independent Summit. This is from where I have taken this, just to mention the source. Measurement of food security environment at country level is done by a Global Food Security Index, GFSI. Parameters such as affordability, availability, quality, and safety with natural resources and resilience are considered to determine food security environment of a country. As per this GFSI 2020, the score of all the AARDO countries who are participants currently in this seminar lie in the range of 35 to 70. Majority of the countries are ranking beyond 70 out of the total of 113 countries considered in this index. So while we are talking about food and nutrition security, this is also food for thought. And this you can find this index at foodsecurityindex.eiu.com/index. That's where you will find the ranking of each of the AARDO countries. Now I'm going to transition to a video which I have recorded specifically for this session and then conclude it again in person.
We also have a copy of the video, so in case this machine doesn't, we will try to project it.
Hello everyone. Thanking you all for joining. I hope all of you are keeping safe and healthy. My name is Sujata Sonik. I'm currently working as Additional Chief Secretary in the Services Department, Government of Maharashtra. I'm also a Takemi Fellow from the T. H. Chan School of Public Health, Harvard University. Today I am going to talk about food and nutrition security during pandemics, disasters and conflicts. Food is a fundamental element for survival on the planet. However, access to food for all has been a critical challenge faced by many across the globe. As a result, food and nutrition security has evolved significantly during the last decades in theory and practice. According to a currently accepted definition by Food and Agriculture Organization of the United States, food security is achieved when it is ensured that all people at all times have physical, social and economic access to sufficient, safe and nutritious food which meets their dietary needs and food preferences for an active and healthy life. Food here is defined as any substance that people eat and drink to maintain life and growth. As a result, safe and clean water is an essential part of food commodities. The nutrition focus adds the aspects of caring practices, health services and healthy environments to the concept of food and nutrition security. This aims at what is more precisely called nutrition security, which can be defined as adequate nutritional status in terms of protein, energy, vitamins and minerals for all household members at all times. We shall now have a look at some of the global and country level statistics related to food and nutrition security. As per the report published in 2021 by Food and Agriculture Organization of the United Nations, about 811 million people, which means 1 in 9 people across the world, have faced hunger or did not have access to enough food in 2020. World hunger increased in 2020 under the shadow of COVID-19 pandemic. After remaining virtually unchanged for 5 years, the prevalence of undernourishment increased from 8.4 to around 9.9% in just 1 year, heightening the challenge of achieving the zero hunger target by 2030. It is expected that more than 660 million people may face hunger in 2030, primarily due to the impact of COVID-19 pandemic. This number is equivalent to double the current population of United States or triple that of Brazil. Asia is home to over 54%, that is 418 million plus people of the total undernourished people, followed by Africa at 37% and Latin America and Caribbean at 8%. Now let us have a look at a few statistics on India's current status related to food and nutrition security. India is home to nearly 195 million undernourished people, which is a quarter of the global hunger burden. As far as child nutrition is concerned, nearly 47 million or 4 out of 10 children in India are not meeting their full human potential because of chronic undernutrition or stunting. Having said that, India has made rapid strides in improving rates of under and malnutrition. Between 2006 and 2016, stunting in children below 5 years declined from 48 to 38%. Yet, India continues to have one of the world's highest undernutrition rates, impacting the child's health and development, performance in school, and productivity in adult life. We shall now have a look at the initiatives taken by Government of India for food and nutrition security. With a 5-fold increase in food grain production from 50 million tons in 1950 and 51 to about 250 million tons in 2014-15, India has moved away from dependence on food aid to become a net food exporter. in 2016, the government launched a number of programs to double farmers' incomes by 2022. These seek to remove bottlenecks for greater agricultural productivity, especially in rain-fed areas. They include the National Food Security Mission, Rashtriya Krishi Vikas Yojana, also called as RKVY, the integrated schemes on oilseeds, pulses, palm oil and maize, also called as ISO-POM, Pradhan Mantri Fasal Bhima Yojana, the e-marketplace, as well as a massive irrigation and soil water harvesting program to increase the country's gross irrigated area from 90 million hectares to 103 million hectares by 2017. The government has also taken significant steps to combat under and malnutrition over the past 2 decades through the introduction of midday meals at schools, Anganwadi systems to provide rations to pregnant and lactating mothers, and subsidizing grain for those living below the poverty line through a public distribution system. There is also National Food Security Act 2013, which aims to ensure food and nutrition security for the most vulnerable through its associated schemes and programs, thus making access to food a legal right. The Act has been formulated to provide for food and nutritional security in human life cycle approach by ensuring access to adequate quantity of quality food at affordable prices to people who live a life with dignity. The National Nutrition Mission, now known as POSHAN, Prime Minister's overarching scheme for holistic nutrition, was launched in 2017 to tackle malnutrition and set the target of reducing stunting, underweight and low birth weight each by 2% per year and anemia among young children, adolescents and women each by 3% per year. It also aimed to strive for reducing stunting to 25% by 2022 along with a 2% reduction every year. This year, Poshan Abhiyan or the campaign has been intensified in the form of Mission Poshan 2.0 and Saksham Anganwadi. Anganwadis under the Integrated Child Development Scheme, the ICDS, according to the central government, is the largest nutrition supplementation program in the world. It is implemented in 2 ways: take-home rations of food supplements for 6 to 36-month-old children and on-site hot cooked meals for pregnant and lactating women and children aged 3 to 6 years. Apart from Poshan and ICDS, the National Food Security Act that covers over 80 crore people have been making efforts to curb hunger and ensure food security for people through the public distribution system, which includes 35 kgs of food grains per month to households eligible under the Antodaya Anna Yojana and 5 kg of food grains per person per month to priority household beneficiaries at a subsidized cost of Rs 2 per kg of wheat and 3 per kg of rice. Similarly, the National Program of Midday Meal in Schools, launched in 1995, aims to enhance enrollment, retention and attendance, simultaneously improving nutritional levels amongst children. Many states in India have launched canteens to provide affordable healthy meals to the poor. Some of the most prominent initiatives are the Amma Canteen, launched by Government of Tamil Nadu, provides healthy meals and snacks to poor population residing in urban areas. The Shiv Bhojan Thali, launched by Government of Maharashtra, provides complete meal at affordable price. I have shared the links for these success stories of these initiatives as a pre-read to you all. I am sure it will be very interesting for you to read it all, and I also encourage participants from different countries to share their success stories related to food and nutrition security in your respective countries during the Q&A session. We shall now discuss on food and nutrition security during disasters. Disasters have a significant impact on food and nutrition security. The nature of food and nutrition problems depends on the type of disaster, its duration, and the size of the area affected, and the nutritional status of the population prior to the disaster. Earthquakes usually have little effect on long-term food supplies. By contrast, hurricanes, floods, and tsunamis directly affect the availability of food by ravaging crops, killing livestock and domestic animals, and destroying stored food. Any type of disaster disorganizes transportation systems, communications, and social economic routines. Thus, even though food stores may exist, the population may not have access to them. It is also observed that disasters affect women and children first. We shall now look at some of the important measures to be undertaken for ensuring food and nutrition security during disasters. So first of all, it's avoiding malnutrition. We need to prevent malnutrition in the population affected by the disaster. It is necessary, however, to plan for the treatment and management of cases of malnutrition that existed prior to the disaster or which have become acute and will become evident during aid operations. The second thing is devising a comprehensive food aid program. Providing food aid is important to the population affected by disasters. We need to take into consideration the following points. Number one, estimate of the quantity of food available, followed by calculate the dietary needs of the affected population. Thereafter, determine the food rations in accordance with the characteristics of the population and estimated duration of the effects of the disaster. Immediately provide food where need is urgent or appears to be, as in isolated populations, institutions, hospitals, refugee camps, and among rescue teams and aid personnel. Ensure the safety and suitability of locally available food supplies that are received. Monitor the food and nutrition situation closely so that the supply and rationing of food can be modified in keeping with changing conditions. We shall now look at some of the important aspects of management of food during disasters. The objective here is to ensure safety and prevent the transmission of disease through food. It is also necessary to inspect the food received and identify and discard damaged supplies. We need to make sure that warehouses in which food is stored have good ventilation and light in order to avoid damage and food wastage. The next important aspect lies in determining appropriate diet for feeding the victims of disaster. As an immediate measure, we must provide any population group that is or appears to be at high nutritional risk with 3 to 4 kilograms of food per person per week. The important thing at this stage is to provide a sufficient quantity of energy, even if it is not a balanced diet. For a short period of time, 1700 kilocalories daily will prevent severe deterioration of nutritional status and famine. The food should be part of a pattern of the population. The quantity of food in a ration should depend on the stage of the crisis and on available resources. For a period of weeks or even months, and while the victims depend exclusively or almost exclusively on food aid, rations should aim to provide 1700 to 2000 calories per person per day. The food ration could be as simple as possible. A basic food, for example, rice, corn, wheat, flour, a concentrated source of energy, oil or any other fat, and a concentrated source of protein, for example, dried or canned fish or canned meat. Although dried vegetables are an excellent source of protein, it is necessary to take cooking difficulties into account. Along with the basic rations, vulnerable groups, for example, children under 5, pregnant and breastfeeding women and malnourished persons need to receive a supplement. We must also adhere to the guidelines issued for distributing food and water in relief camps. For instance, the National Disaster Management Authority, also called as the NDMA, have issued guidelines on minimum standards for relief. These guidelines detail out standards for food relief during disasters and other calamities. We shall now move on to the next section on food and nutrition security during pandemics. The entire world has been grappling due to the effects of COVID-19 pandemic. Food and nutritional security targets have taken a severe hit due to this pandemic. Numerous countries are experiencing high food price inflation at retail level, reflecting lingering supply disruptions due to COVID-19, social distancing measures, currency devaluations, and other factors. Rising food prices have had a greater impact on people in low and middle income countries since they spend a larger share of their income on food than people in high income countries. Rapid phone surveys done by the World Bank in 48 countries show a significant number of people running out of food or reducing their consumption. Reduced calorie intake and compromised nutrition threaten gains in poverty reduction and health and could have lasting impacts on the cognitive development of young children. COVID-19 is estimated to have dramatically increased the number of people facing acute food insecurity in 2020 and 2021. World Food Programme estimates that 272 million people are already or are at risk of becoming acutely food insecure in the countries where it operates. Acute food insecurity is defined as when a person's life or livelihood is in immediate danger because of lack of food. Hunger was trending upward even before the COVID-19 pandemic, which exacerbated existing effects from extreme climate events, conflict, and other shocks to economic opportunities. As far as nutrition is concerned, COVID-19 has had two effects on nutrition, direct and indirect. Let us have a look at some of the direct effects. Observations from Maharashtra's medical colleges show that malnutrition has increased enormously in babies who were admitted for COVID-19. It has been observed that COVID-positive women delivered more preterm, low birth weight babies who may suffer from severe acute malnutrition in no time. Rising unemployment, declining food production, disrupted supply chain, poor preservation, etc. are some of the indirect effects of COVID-19. The pandemic also had impact on various schemes such as midday meals. Due to decrease in income levels, food affordability has also taken a hit. It has been observed that for every 1% drop in income results in decrease in fat intake by 0.14%, protein and carbohydrate by 0.12%, and iron, zinc, etc. by 0.13%. Average Indian spends about 33% of his salary on food compared to 6 to 8% in the United States. COVID-19 pandemic has significantly affected nutrition security. As per UNICEF chief Henrietta H. Fore, wasting in children will increase by 14% due to effects of COVID. The families who were consuming at least 4 to 5 times a week food items such as vegetable, pulses and animal products have reduced the consumption to 2 to 3 times a week with lesser quantity due to increased cost. These healthy foods are now being replaced by ultra-processed foods which are cheap, affordable, easily available and convenient. They contain high sugar and salt. Families tend to buy them and give young children to address hunger. However, hunger is not translating into nutrition. In order to address the challenges pertaining to food and nutritional security at global level, we need to prepare a collaborative and comprehensive vision and action plan. This includes developing a robust and sustainable strategy which calls for better coordination between global organizations. This also includes getting regulatory framework, work for participating of private sector food companies to be more sensitive to families who are nutritionally deprived. During pandemics such as COVID, epicenters should be accorded priority for planning to strengthen programs for improving food and nutrition security. We must have provision for special corpus of funds to women groups and youth groups for community marketing. There is a need to establish robust data management systems to ensure that families affected have specific cards to get entitlement. Technology will play a key role in achieving food and nutrition security targets. Technological interventions in implementation and monitoring of policies is important. However, we can also use technology in designing sustainable policies. I would like to draw attention towards one such tech-driven initiative. It's called the Policy Maker. Politics affects all aspects of public policy. What gets on the agenda, who supports an issue, who opposes an issue, whether an issue receives official approval, and whether the official policy is implemented. Dr. Michael Reich has worked with David Cooper to develop a Windows-based software program for applied political analysis. This tool, called Policy Maker, provides a computer-assisted guide for strategic political thinking about policy reform. Policy Maker is a logical and formal procedure to provide practical advice on how to manage the political aspects of public policy. The method helps decision makers improve the political feasibility of their policy. Such interventions will increase the efficiency and effectiveness of the processes. I am confident that with better coordination, collaboration and cooperation, we will be able to achieve the objective of zero hunger, thus ensuring access to quality and healthy food for all. Thank you for your participation. I am sharing a list of post-session reading material. Please feel free to reach out to me for any clarifications. So I would just like to conclude now with a few words and thank you so much for the support for running this video. That as on 2021, there are more than 9 countries of AARDO such as Egypt, Pakistan, Syria, Yemen, Ethiopia, Burkina Faso, Nigeria, Sudan, Tanzania, which are facing conflicts at various levels. Food and nutrition security measures are taking a severe hit, and it has become even more important to devise strategies to address conflict-related challenges. So therefore, I feel that given the collective wisdom, expertise, and experience of this diverse group of researchers, professors, and policymakers, we must build sustainable solutions and push the agenda of food and nutrition security to the top of the list of developmental plans at regional and global level. We took the first step in India by incorporating the minimum standards of relief in our disaster management plans. And I hope that through multiple integrations and using tech interventions such as Policymaker, which I just defined, which is open source, it will help us to prepare sustainable policies based on research and evidence and can make food and nutrition security a reality. Thank you once again for your patient hearing. Dr. Parthasarathi, over to you.
Thank you so much. And thank you for bearing with all the technical issues and still ensuring that all the important points came across both in the video and in your initial introduction and the summary. I think this was an excellent overview of the nutrition situation and the policies in India and the various factors that affect the nutrition security situation. And I think the a initial part where you outlined the various policies in India addressing food and nutrition security historically, at the same time pointing out the contradictions in a country where so much of policy and financial investment has been made on food and nutrition security. The problem continues to persist for various reasons, and especially worsens during times of crisis like the pandemic that you mentioned. And I think, and then you went on to talk about the impact of disasters on food supplies, especially women and children. And I think the point that you made about considering both the direct and indirect effects is something that's extremely important and not always given sufficient attention by policymakers or government actors. And then I think the long list of suggestions to ensure that we are adequately prepared and we put in place logistics to ensure food security during a disaster. I think that was also very comprehensive. And though you mentioned it in passing when you talked about the policymaker tool, I think the point that you made about politics and how it affects public policy is extremely important, because if we ignore the way in which politics affects the policy tools that we choose and how these are implemented, then I think in spite of the excellent preparation, sometimes things can go wrong. So it's very important to keep an eye on that as well. So thank you again for your presentation. We'll now open up the session for a few questions or comments. So I see a few hands up. Just a second. Yeah. No, I think somebody had the hand up and then they put it down again. Let me see if there are any questions in chat. So this.
I think you can request the participants either to raise their hand and ask a question or put it in chat. And Professor Param can check if we have any questions in the YouTube side.
Yeah.
Yeah, sure.
Yeah. So please, any of you have any questions or comments, please do switch on your video, unmute yourself and pose the question. Or you can also choose to, if you have bandwidth issues, you can also choose to pose your question or comment in the chat.
So while we are waiting for the questions to come forward, I can just say that, nutrition per se is a very complex topic, and it involves not only quality of food, but it is directly linked to issues of clean and safe water, hygiene, sanitation as well. So just giving, nutritional supplementation through food is not going to solve the problem unless it comes as a complete package. So,
yeah, absolutely. Yeah. That's again a very important point, because it's not just about shortage of food or lack of access to food. It's a combination of many factors.
And also control of malaria and diarrhea.
Yes. So we have a question here from Sudan, Magda Ahmed. So which type of disaster affects nutrition security? I think partly you had covered this in your talk when you mentioned that the earthquakes tend to have a different kind of impact in the short and long term compared to other disasters. Maybe you'd like to elaborate on that?
Yes, certainly. So all types of natural disasters, which include, sudden and heavy rainfall leading to flooding. It could also be a cloudburst. It could be a cyclone. So anything which is a short term to a medium term disruption of normal life disaster is going to impact disruption of food supplies and is going to lead to nutritional and food concerns. And it will always take time for the first responders to set up those supply chains again. And in the interim, you may have to provide for some sort of sustenance to those who are affected. So building local food stocks also in vulnerable areas where a hazard vulnerability analysis has already been done, and involving the community in planning for such events can definitely help. So this is as far as natural disasters are concerned. And if there's a man-made disaster, and we see so many of these man-made disasters, particularly the ongoing conflict in many of these countries, it has led to a very long-term impact on food supply to the vulnerable population, especially women and children who will typically not go out of the safe area. They will stay indoors and wait for the more able body to get the food inside. And I had shared one movie as part of the pre-session sort of reading or viewing, A Private War, covered by Miss Mary Colvin, who's an award-winning journalist and who died covering her story in Syria. Shows you how a population was totally cut off from food supply, and they were dealing with hunger while in hiding. So conflict situations will bring a more long-term sort of disruption and delay.
Thank you so much. I think Professor Parmeshwar has some questions from YouTube, but before that, maybe we can take one question here and then go.
Syria. I think there's a question from Syria.
Yeah. Dr. Muhammad Al-Hoshan, please go ahead.
Yes. Thank you very much for a good presentation. I have one question. Is there a difference between food security and nutrition security, or the two are the same? Thank you very much.
Thank you for joining from Syria. It's so nice to connect with you, and thank you for your kind words. So your question was, is there a difference between food security and, I couldn't hear the second word.
And nutrition security.
No, I think food and nutrition security is what globally governments are discussing today, and they are bringing it forward as a goal to be achieved by all countries. As I said, maybe I didn't actually explain it in so many details. When we started out somewhere in the 1960s is when we started talking about hunger and food as, things that a government has to take care of. But over the decades that we have seen, and particularly in this decade, we have seen a growing focus on also talking about nutritional security. So food and nutritional security as on date are a single concept. And it's a goal that all governments have to work towards. Not all of us have achieved it.
Yeah.
I hope that helps.
Thank you. Professor Param, can you pose a few questions from the YouTube?
Yeah, I don't see any question on YouTube, but I have my own question here.
All right.
Yeah, so thank you, Ms. Sujata Sonik, for very interesting presentation here. I'm Parameshwar Odmale, recently joined assistant professor in Sitara, and this agriculture as well as disaster risk research are areas of expertise. And from this semester, I am also delivering one coursework, hydrometeorological hazard risk assessment. So I find this very interesting with respect to disaster risk point of view as well as food security point of view. So considering this, I would like to know from your side that what kind of preparedness activities would be more important for food security as well as multiple hazard disaster point of view, considering including COVID also. So could you please elaborate on this? What kind of preparedness activities to ensure food security during multiple hazard events occurring at the same time? Yeah.
Yes, you are aware that recently there has been a report of Center for Science and Environment, which has said that India is currently at risk of suffering from multiple hazards at the same time. And the same region could be experiencing different types of disasters. So obviously the responding agencies are also stretched because they have to have a series of response mechanisms ready and handy. So I think the most important thing to be done today is that we need to relook at our disaster management plans, which we would have prepared pre-pandemic. And now with this hindsight of having faced the second wave of COVID-19, we need to make sure that, one thing is have as much as possible local supply chains, locally grown food to be made available. I was reading the other day that in Odisha, they have now included millets, pulses, oilseeds, and fruits and vegetables in government welfare programs, including in the meals being offered in Anganwadis and midday meals in schools. So local recipes local products as much as possible, if they are incorporated into the food supply chain and the community at large is made aware of the benefits of this, I think it can help a long way in providing relief rather than bringing food from outside and supplying it.
I think that is very thoughtful or suggestion to be explored as a researcher. So thank you very much for that.
Thank you.
Thank you.
Thank you. If I could just, add to this response. So we're doing a project where we are working with this pastoralists, the Maldharis in Kutch, in Gujarat, in Western India. These are people who are nomadic with cattle and camels and sheep, goats. So during the pandemic, some of our researchers went to see them and check if they are all right, whether they're facing problems of food security. And one of the things they told our researchers who are from cities that we are doing very well. If you need any help, tell us, we'll support you. So that sort of told us about the importance of local food security, because they were not much in contact with people from urban areas and they were not affected by COVID. But at the same time, they were not also affected by the break in supply chains because of the lockdown. So they had local supplies to depend on. And the same thing I saw from a very different context in UK, where I was in a conference a couple of months ago. And this was a paper where a group of people have been farming collectively in the south of England. And this started some 3-4 years ago. But during the pandemic, they realized the value of it because the supply chain stopped. They didn't get any food, but they could just grow their own food and survive on that. And that is now being used as an example to promote more local food production in England itself. So, and the other point about the multi-hazard. So again, in our project, we are using this term, which is becoming popular now. It's called compounded disaster or cascading disaster, where multiple hazards and disasters, cascade one into the other and have multiple different kinds of impacts. And as Ms. Sujata mentioned, it's important to consider that in a more complex way in terms of in policy terms. Yeah. Thank you.
May I just add one point here?
Yes, please.
That since we are a group of policymakers, researchers, and professors sitting together here for this session, I also want to mention the importance of doing, mapping, or rather, I should say, layering of health data with climate data. Yeah. So, if in a region which is prone to natural disasters, including in conflict areas, if we can map health data on top of climate data, it will give us an early warning of which particular villages or regions are likely to be affected by disaster. And using machine learning and artificial intelligence in due course, we can come up with predictive models to start preparing for it in advance.
Some kind of initial research is started at my lab here in Sitara also. So multi-hazard point of view, cascading nature of hazard, and then whatever impact. So we don't have enough time. Sorry about that one.
Sorry, we are running out of time. So maybe just the last 2 questions we can have. One from Neda Ahmed, who has a question about how to balance between the amount of the quantity of food and food quality during disaster times, which were touched upon. Maybe you'd like to elaborate on that, how to make a balance between these. And the second question is an oral one, which I will request Wong from Taiwan to pose to you. Maybe you can take both together and then we can close this session. Yeah, Wong?
Hello, can you hear me?
Yes, we
I
can.
hear you.
Okay. Thank you for the sharing. I totally agree with the plan that you mentioned about the local supply chain. But I think because in Taiwan, if you are leaving the city, there is no farm near to the city. So I think the food delivery, the pathway or how to manage the delivery, the transportation of the food is also very important during the pandemic. And I think because the pandemic wasn't really go away, I think they will come back again and again. So we can make a better plan every time. So I just want to emphasize that maybe the delivery is also important strategy. Thank you.
Yes. Thank you for a very important comment that you made. And in urban areas, and especially countries or locations where urbanization is very high, food supply is going to be a big challenge. And we have seen it during lockdown, how in many cities and metros across our countries, there was disruption. And what did we do? We went back to eating basics. So we were eating more of pulses and rice. And, we were setting up supply chains for those items on priority rather than setting up supply chains for fresh vegetables and fruits, because that supply chain got totally disrupted and it took much longer to set it up. So in urban areas, there has to be a totally different approach as to how to manage it. And on the other question that was asked about how do you ensure, proper sort of nutritional aspects of food that is being given, that we have worked out in our, this NDMA's led initiative for having minimum standards of relief. We focus specifically on how we should provide for each category of people who are likely to be affected in a disaster, and make sure that the food items are not given in a generic manner, but we look at how many babies are being fed, how many pregnant women are there, how many elderly people are there, because their requirements will be different. You can't cook one meal and then expect everyone to eat. So those kind of detailing will have to be done moving forward to ensure that enough calorific inputs and supplementation is going to each of these groups. I hope that's helpful.
Yeah, thank you so much. There are a couple of other questions, but we don't have sufficient time, unfortunately. We need to move on to the next presentation. So thank you once again to Ms. Sujata Sonik for this very comprehensive presentation. And I think given the fact that this is a training program, the large number of actionable points that she mentioned, especially, I think are important takeaways for us from this talk. Thank you again. And thank you to all those who asked some very interesting questions. Thank you.
Thank you, Dr. Parthasarathi, and thank you to the organizers for giving me this opportunity. Thank you.
Thank you. We'll now move to Professor Nitya Rao. Nitya Rao is professor in gender and development at the University of East Anglia in Norwich in the United Kingdom, which is also Professor Agnihotri's alma mater. Nitya has worked extensively as both a researcher and as an advocate and activist in the fields of women's rights, employment, education for several decades. And among her research interests, she's been exploring the gendered changes in land and agrarian relations, migration and livelihoods, especially in contexts where there is climate variability and economic precariousness. She's also done fine-grained ethnographic research on households, intra-household dynamics to better bring out the implications, especially policy implications for gender well-being, empowerment, and justice. And that is where her focus on food, nutrition, and health security has been very evident, which is what she's going to speak on today. She's constantly engaged with policy and practice, both at global and local levels in India and abroad. And she's also served on several committees, including the Global Advisory Committee of the UN Girls Education Initiative, as well as a member of the steering group of the high-level panel of experts to the Committee on World Food Security. Over to you.
Thank you so much, Partha. And I hope you can see my screen. I kind of shared it to save.
Yes, we can see it, yeah.
So thank you so much for this invitation and to be able to participate in this training program this morning. And I think following from the previous presentation, I think which I will specifically focus on the COVID-19 and what it has done globally in terms of the effects on hunger, malnutrition, food and nutrition security. And I will try and take a gendered lens in my analysis. A lot of what I will say actually draws on an issues paper that was produced by the high-level panel of experts to the Committee on Global Food Security in a quick review to inform nation states about what was going on and what should be the policy responses. So I think, first of all, to start with, just in terms of background, we know that, COVID is very widespread. This is just the latest figure from the John Hopkins coronavirus tracker, that as of yesterday, the total of 228 million infections and 4.6 million deaths globally. But the good news, of course, is now that there are also 5.9 billion people who have had the vaccination. And one can see that the spread of this, I think there is a question about data that in many parts of sub-Saharan Africa, even though North Africa, there is concentration, Europe, Asia, Southeast Asia, I think almost everywhere, and of course, North America, Latin America, across the world, I think there has been this spread of infection. And this, I think I just wanted to present to give a global picture of the sort of hunger map, if you like. And I think this is quite significant. The previous speaker also mentioned that there were already, even before the coronavirus pandemic, the world was not on track to achieve the Sustainable Development Goals on food and nutrition security. There were a very large number of people who were experiencing hunger and so on. But the predictions now are that because of the coronavirus pandemic, another almost 83 to 132 million additional people, as per FAO estimates, might become hungry, have inadequate food. And particularly of this figure, I think they have said 38 to 80 million people are in low-income countries and that rely on food imports. So I will talk a little bit also about the effects on countries which rely heavily on food imports and exports and the way that they have experienced the coronavirus pandemic as well. I think there was a question from Taiwan at the end of the session that what do countries which don't have their own production, how do they actually manage with this and how are they affected? From the Middle East, at least 25 countries, including Lebanon, Yemen, and South Sudan. I think the world, the Rome-based agencies, the Food and Agriculture Organization, and so on, have pointed out that these are likely to see actually significant deterioration in food security. So they were already food insecure, and now this is going to become worse because of not just health, but also the socio-economic impacts of the pandemic. So this is, I think, the definition was given by the previous speaker of food and nutrition security, which has been accepted for a long time, since 1996, that all people at all times have physical, social, and economic access to sufficient and nutrition food, and so on. Now, the high-level panel in its report last year in 2020, we took the same definition, but we said that it needs to be, from a conceptual perspective, we need to actually think not just about availability, access, utilization, and stability, which were the four kind of dimensions of food security, but we added two more with the same definition, and that is agency and sustainability. What agency really means is that it includes empowerment, it includes giving control to local communities and populations to take action. It includes many of the things like control over what to eat, what to grow, from where to purchase it, how to cook it. So these are the kind of areas in terms of giving people, particularly women, control over what is eaten and how it is produced and how it is cooked and fed, is something which we include in the concept of agency. It is really about control. And sustainability, of course, we all talk now about sustainability, which is how do we ensure also that this food and nutrition security remains for the future. It is not only short term. And I think this is something, again, that I will comment on in the context of COVID, of how future sustainability might also have been affected. As I already said, many people who were actually food secure, another 80 to 130 million have become food insecure because of this pandemic. So this really poses a question about the sustainability of our food systems. So this is, I think, just to say that COVID-19, of course, was very widespread. It has been an illness, but it has unleashed a whole set of dynamics which have affected food systems and food security and nutrition, starting with policies of lockdown, which disrupted supply chains, which disrupted social protection, which pushed the world, in fact, in towards a global economic recession with uneven food price effects, changes in production patterns, food environments were altered. But very importantly, I think we find an increase in global inequalities between men and women, between rich and poor, between poor and rich countries as well. Those countries who have had wealth, and we see this with vaccines also. Those countries who have the money have been able to somehow manage, have been able to vaccinate their populations, whereas other countries, particularly in sub-Saharan Africa, are way behind in terms of so the effects of COVID-19 clearly are not equal across societies. So I will just look at some of these different dimensions and what has been the impact. So when we talk about lockdowns, I think what happened with sudden lockdowns was that all transport, all movement came to a complete standstill. And from a food security perspective, food system perspective, this affected the supply chains. And I think this was also the question from Taiwan, that there was lack of transport, there was lack of storage. And this has affected both producers and consumers. So this picture is from Odisha, actually from Koraput, in normal times, a very bustling weekly market, local market, where the local populations, men and women, they come to sell their local produce. They also come to buy fresh fruits and vegetables. What happened with the lockdown is that these markets also shut down and these farmers could no longer sell their produce. And in fact, we had many stories of how farmers, in many cases where it was only a cash crop they were growing, like floriculture, flowers or fruits, they actually left it on the fields to rot. They did not want to invest extra money even to harvest it. They lost incomes. They were unable to recover costs. The other thing is, of course, a big market for many of these perishables is from not just individual consumers, but also from hotels, restaurants, schools, colleges, hostels, canteens, and so on. And of course, with the lockdown, all these also closed. So the demand declined as well. In many countries, we find, and this is not just India, I think this was something which was visible in terms of perishables and horticultural commodities across many African countries, Ghana, cocoa, and many other kinds of countries, particularly countries dependent on exports, like many of the African countries. Kenya depends on beans, or Ghana depends on cocoa. I think these countries were also lacking in incomes. There were no export markets, and they were at high risk of food insecurity due to border closures. Interestingly, in Europe and in developed countries, it was not maybe so much the producers, but a lot of workers involved in food processing, packaging industries, meat packing industries in Germany or other places, where they really suffered because they were cramped in small places. Many of these are migrant workers. They got sick. There was no proper facility for quarantine, and these facilities closed. People could not go home, and they really suffered because of these lockdowns. I think this, of course, led to global economic recession and economic downturn. The IMF has estimated that almost 5 to 8% decline in growth overall. And this has led, of course, to huge drop in jobs. In India, there was an estimate that 46% of jobs were lost during last year, 2020. In Latin American countries, 50%. So like that, there are estimates about job losses, and particularly in informal sector. So this affects the poor much more, who are working as street vendors. In South Africa, the informal markets, the vendors were closed. So the street vendors lost their jobs. The other kinds of cleaners, the petty traders, all these jobs were lost. And what this has meant is that as people are no longer sure of how much income they will be able to earn, it has reduced their purchasing power and also contracted food demand. So again, the World Bank estimates that almost 100 million people actually reduced their consumption globally during this period, and about 135 million started facing acute hunger. So I think this is important, that jobs are lost, incomes are lost, and therefore the demand for food and what people start consuming is reduced. In India, there were estimates that 50% of rural households, or more than 50%, they started eating one meal less, or only one proper meal in a day instead of 2 meals a day. So this has, of course, long-term implications also on food and health. So I mentioned about widening social inequalities. And I think this is something we really need to understand, that the WHO estimated that 1 in 3 people who live in slums or low-income settlements, actually, they did not have access to food, they did not have access to water. And of course, the treatment for COVID-19 was keep everything, good hygiene, hand washing, and so on, frequent hand washing. And here people did not have access to water, access to sanitation. And this has really led to widening social inequalities. Women in particular had to queue for many long hours at common water points. This is from a slum in Delhi, in order to get water, even for basic hygiene. Apart from that, access to basic services, and I will talk a little bit more about this, that health services, all the health services is in India. The previous speaker mentioned the Anganwadi centers, the ASHA workers, that is the accredited health workers on the ground. They were all put into duties for COVID-19 tracking. So your regular health services came to a standstill. Education, schools have been closed, childcare services came to a close. And of course, this added to the work burdens of women, preventing them from doing things that they could otherwise have done. And the final thing is about people really getting into very, very precarious, out of desperation, any kind of job for low wages in unsafe working conditions with no protective equipment, and a complete suspension also of workers' rights. I think this we find in South Asia, in Southeast Asia, especially in informal employment, that people have really worked in very, very difficult conditions. One particular category which I will just like to highlight very briefly from the case of India is the plight of migrant workers. We know in India that almost 1/6 of the population is migrant, is working outside of rural areas. They lost jobs and incomes, and photos like this were very common. Images like this were very common last year with the lockdown, that they were literally traveling back home thousands of miles walking. They got dependent on charities, on NGOs for their daily food packets. There was no dignity in terms of what they got to eat, how much they got to eat. They had no access to toilets. There were stories from many cities that when people tried to come out to common toilets because of lockdown measures, the police hit them and sent them back into these very cramped accommodation. Many people lost their lives traveling back home, children died, and those who could afford some kind of private transportation was very expensive. And so whatever they had earned, they lost their savings. Even when they came home, quarantine centers had been set up, but these were very poor in terms of the facilities that they offered. And women in India, also from these poor communities, and this is from work that I have been doing over the last 25 years in Jharkhand in Eastern India, that the Santhal women, they migrate to West Bengal seasonally in March, April for potato harvest. And this has been called Aloo Joms. So potato as food, that is, they get paid in both cash and kind. They get 2 sacks of potato plus some cash income. They were there, they had completed the harvest, but then the lockdown came and the transportation, the buses were all stopped. So these women then had to start walking back home, about 200 kilometers. And of course, that meant that they did walk, but they could not carry these sacks of potato, and they just sold it very cheaply. So though they had done the work, they had been paid, but they came back with very little income. Where women had not migrated, but where men had migrated, like I showed you, and they came back also with very little income, the government of India, it did start under the Mahatma Gandhi National Rural Employment Guarantee Program. It really increased the days available of work for which was paid. But of course, a lot of this is manual physical work. So women were engaged in this manual physical work, but at the same time, because of lower incomes, there was less food that they were consuming. And this has led to a lot of exhaustion, a lot of tiredness, and also depleting of their own body resources. Hard work with less of food, and primarily because they were responsible for ensuring somehow food security to their families. And I just wanted to put this in the context of what I said earlier, that, many of these countries which we are talking about already even prior to COVID, had inequalities in terms of gender, in terms of hunger, in terms of nutrition, and so on. And this was based on a time use and diet survey that I had done in 2 states of India, in Odisha and in Maharashtra. And we looked at a few households during the 3 seasons, planting, harvesting, and lean season. So this was 2018-19, before the pandemic. And already at that time, we found that if we looked at the total work over a 24-hour period, women were doing more than 50% of the total work, 56%. And within agriculture, during these peak seasons of planting and harvesting, they were doing 75 to 80% of what men did. And they were doing 95% of all the domestic and care work. Now we know that especially for nutrition security and for young children, regular feeding is very important. And during these seasons, we found that because women had so much, 8 to 10 hours a day, they were working in the fields, that they had very little time left for cooking and feeding. So this time really shrunk for the most marginal women by 30%. For looking after, for feeding and cooking particularly. And this, of course, has impacts on child nutrition, but also on women's own nutrition. So we found that, during these peak seasons, actually women were losing 3 to 4% of body weight compared to men because of reduced consumption and intense activity. And the slide that I just showed you, that during COVID, this whole thing became even more intensive than usual. So talking about gender inequities in particular and the exacerbation of gender inequities in most of our societies in low and middle income countries, maybe not so much in Europe and North America now, where there is much more equal sharing of responsibilities. But in South Asia, Southeast Asia, Sub-Saharan Africa, North Africa, and Middle East, women are primarily responsible for procurement of food and feeding the family. And this, of course, during the COVID pandemic, as I've been describing, has led to enhanced stress. There is lack of money because the men who came back from their migrant jobs, they did not bring much money home. So you could not purchase essential commodities. While was previous speaker mentioned about the public distribution system, which was really a savior for many people because it gave basic food grains at cheap prices. But many women I spoke to told me that we got the food grains, but we did not have cash to buy oil or cooking fuel, LPG cylinders, spices, salt, and so on. So while basic food grains were provided, but people really did not have access to other kinds of ingredients which are needed to cook a meal. And this was very distressing to women. It increased care burdens, as I already said, for children because schools were closed, Anganwadi centers were closed, for the elderly and the sick. It led to longer working days, but also increase in violence. And this is WHO figures globally, including in developed and developing countries, that the level of violence against women really increased during the lockdown. First of all, men were frustrated because of unemployment, because of sitting at home. There was not adequate money to prepare good food and eat good food. There was no health services. I think also very importantly, the Population and Health Foundation of India, they have noted that also there has been a neglect. All the health services were directed towards COVID-19. So there has been a neglect of sexual and reproductive health. Many people, as during other crises, especially the poor, engage in risky and undesirable practices like child marriage, trafficking of the girl child, and so on. Disruption to social protection programs has been very important here in terms of especially closure of schools and midday meals. And globally, I think the estimate is of the World Food Program that 370 million children have lost access to school meals due to school closures in developing low and middle income countries. And of course, for many children, this was the main nutritious meal that they got in a day, and they have lost access to this. Loss of adequate access to health services, I have already said. So a few more points. One is about food environments. And I think this was something that was mentioned earlier, that the same market that I showed you in the beginning of my presentation, which was a buzzing market in Koraput, and during the lockdown, it looked like this. The stalls were there. It was completely deserted. Now, this closure of these kinds of markets particularly have impacts on the poor, because the poor depend on these local markets rather than on retail shops, supermarkets, and so on, particularly rural communities. I think a big issue has been a decline in perishables, in consumption of fresh fruits and vegetables, and a reliance on grains. And we find this particularly, in some countries, there are figures, for instance, from Venezuela and Guyana, that this kind of led to price instability because over 50% they depend on imports. So completely the poor could not afford this kind of food, fresh foods at all. There is also a possibility of decline in production due to supply chain disruptions for inputs and marketing. But India has been lucky in this respect, because we find that over this pandemic year, the agriculture sector, due to good harvests, has done well. But on the positive side, I think in many cities in India, we have found, but also in the UK, where I am currently based, that there has been a growing interest in home gardening and in community gardening. During a lot of the lockdown period, I was in India, in a city, in Chennai, in South India, and many people got interested in urban and peri-urban agriculture. In fact, IIT Madras, the Chennai Resilience Center, was distributing kits of seeds and so on to whoever wanted, particularly in shelters, in care homes, in hostels for poor children, that where they started their own gardening. So on the positive side, I think there was some interest in much more local production as well in cities and in peri-urban areas. And this is a good trend for the future if this persists. So what are the implications for food security? I think if we look at the 6 dimensions that I mentioned of food security, I think in terms of availability, there has definitely been a local variability in terms of crops. So the grains were less likely to suffer than fruits, vegetables, and perishables. Also, as I said, in developed countries, which depend more on mechanization than on labor, they were less affected than those in developing countries who depend much more on human labor. In terms of access, poor households on tight budgets have really cut food spending. And especially we find that in countries, low and middle income countries, where people spend more than 50 to 80% of their budgets on food, these have been badly affected. Utilization is about how the body absorbs. That is really about nutrition. And here we find clearly a decline in healthy diets, which has reinforced malnutrition, alongside the other enabling conditions for good nutrition security, like lack of access to clean health, water, drinking water, enhanced health risks, and so on. In terms of stability, I have already spoken that the disruptions in food supply chains, it has led to a rise in prices in food in many areas, which has made food unaffordable for the poor. There is also the uncertainty about the pandemic. How long is the pandemic going to continue? Will it be 1 year more, 2 years more? And this has led to a destabilization also of global food markets. People don't know. So there is hoarding, stockpiling, selling at higher prices, and so on. Agency, the most marginalized, those who have lost jobs have been affected. Also because any kind of collective action or resistance, because of the restrictions to group gatherings, to coming together, people cannot really protest or come together because of these physical distancing norms. And finally, I think on sustainability, we need to really think, because the pandemic has diverted our attention from long-term stability, from long-term sustainability issues around fragile ecosystems, climate change, the type of production that we are doing, and so on. For instance, now a lot of food wastage because of closure of institutions, hostels. Earlier we were moving towards much more recycling. Now, because you can't touch, there is social distancing, physical distancing. So a lot of single-use packaging for the environment. So I think these are issues we need to think about moving ahead. So just to have a few points in terms of conclusion, I think I mentioned the high-level panel of experts to the Committee on Food Security. And already before the pandemic, we had said last year in the report that if you're thinking about moving towards 2030, I think one really needs to think about a radical transformation of food systems as a whole. And this would mean that also including, thinking about marginalized groups, about food supply chains, about how do we make sure that during disasters, during pandemics, that we're still able to keep the food system moving and not collapse like it happened last year. So we need to see it also as interconnected with other systems and sectors, especially health and the economy, global trade, global export-import policies. I think these need to be seen as an integral part of the food system. We have to focus on hunger and undernutrition, but also on malnutrition in all its forms. This is what the pandemic showed us, that while we were able to have grains, but all other kinds of nutritious foods, pulses, lentils, meat products, fruits and vegetables, the supply chains collapsed. So we need to also focus on malnutrition. This is very critical. And finally, it has to be context specific, where therefore we require diverse solutions. We can't have one size fits all solutions. If it is an indigenous tribal population, we need to have a particular type of solution, which they had. Traditionally, they had grain banks, they had seed banks and water banks, but gradually these have all been, community institutions have been allowed to decline. So we really need to build up that sense of community and move away from very individual focused approaches. So I think some of the learnings and strategies really are that for the vulnerable in all our societies, we need to make sure that social protection programs are strengthened and not allowed to disappear. So health insurance, production support, school meals, and so on. There needs to be a coordination of policy responses. So it can't be that the health system is saying something and the export-import policy is going in a different direction. It has to be coordinated. We need to have both production systems, which have to be more resilient, because this year also what happened that, with a lot of high yielding, commercially modern kind of agricultural systems, depending on inputs, the inputs also could not reach the farmers. So we also need to make food production systems more resilient, but also food distribution systems more resilient, including shorter supply chains. And I think finally, I will end with the point on data, that we really need robust data to inform decision making, which has to be accompanied by very transparent communication strategies. So we really need to have the information, people need to have the information, it needs to be readily available, and it needs to inform all decision making. Thank you so much. I'll stop there, Partha.
Yeah, thank you so much. Yeah, I have had to shift to a different headphone because it's raining heavily outside my window and I can't hear myself also. Much less here. So yeah, thank you for that again, very comprehensive presentation on the ways in which nutrition security was affected by the pandemic and the handling of the pandemic also. So it's the policy response. Sorry, you can't hear me? Am I audible?
Yeah, it's fine.
We can hear you. Yes.
Yeah, okay. Yeah. So we must remember, I think this is an important takeaway, that while the pandemic did definitely affect food and nutrition security, it was as much the handling or the mishandling of the measures to contain the pandemic that also affected food security. And so linking to the first presentation by Ms. Sujata Sonik, I think it's important to think about disaster impacts, but also the disaster management impacts, the side effects, the indirect impacts that they both very clearly talked about. So Professor Nitya Rao very clearly outlined how the food security situation actually deteriorated due to the pandemic, and how in fact coping, which is often seen as a response to disasters, actually meant more malnutrition because people coped by eating less or by skipping meals and so on. And of course, we need to understand the deteriorating food security situation, not merely in terms of the food consumed, but also how indirectly widening inequalities, especially gendered inequalities, also had their impact on food security. And this is where I think your point about women playing multiple roles, employment, food security, caregiving, how these lead to compromises and affect all three different roles that women play. And I think especially for children and for maternal care, the disruption of the social protection programs, especially Anganwadis, I think it's something that's very important. And I think from the perspective of training, which is what this program is about, I particularly like the way in which you link the 6 different dimensions of nutrition security to different policy responses. I think that gives us clear strategies both at the local and regional levels and national levels about how to address food security, especially with a gender focus when it comes to disasters. Uh, and I think the additional dimension that you brought out is also important across many of the developing countries, the focus on migrant workers. Because going back to the earlier presentation where Ms. Sujata talked about the importance of mapping supplies, logistics, resources, and then also doing a mapping of those who are most vulnerable and identifying them. And this is something that's actually mentioned in the guidelines of the NDMA, the incident response system, and so on. So, and this exercise, which is very important, actually becomes much more complex when it comes to migrant workers. It's so very difficult to map where they are, to identify them, to find them, to make sure they get critical supplies. Because the new national database on unorganized workers hopefully might give us that data, which is important to address their needs. So thank you. And once again, it gives not just an overview, but a nuanced outline of significant and critical points that need to be addressed to ensure that food insecurity is not advanced during pandemics. So let's open it up to questions. And I see already that Professor Narendra Shah has his hand up. So, and we both had done a study together, and I was remembering Professor Shah, when in Nitya, you mentioned the point about food preference as one of the pillars. And this is something that's so often neglected. So this is a point that we addressed in one of our projects in Dharavi here. And that turned out to be, something that was innovative and very useful in terms of enhancing the implementation of the ICDS in an experimental study in Dharavi. So maybe the first question we can go to Professor Narendra Shah.
Yeah, thank you, Professor Partha. Professor Nitya Rao, a very, very impactful presentation from your end. I do not know how long you are there where you are now in UK, but when sort of in these phases of COVID-19, when it was like early scare last year, February, March, and sort of second wave and things like that. In an organized markets and supply chains like in UK, for example, what did you observe? I mean, because in the first wave, people almost did not know how to handle it. Our medical fraternity or the people from medical sciences did not know how to handle this. And there must have been a scare, even whether food is transmitting or not, or it's only air, through air, people are getting this kind of a, viral infection. So what are your observations as to how did they handle the supply chain? You did mention about India, in Koraput and small rural communities and all that. But we would really appreciate if you could tell us from what you learned there in that part of the world.
Thank you, Dr. Shah. Actually, I was in India during the lockdown, so I didn't really experience it in the UK because a lot of my research is in India, and I had already come last year in January. So I was in India during the lockdown. But from what I read and heard, I think they also handled it very badly. I think Europe and UK handled the first wave very badly. There was a lot of hoarding. People did not know what to do. So they apparently supermarkets were kind of, shelves were emptied out. People were buying dozens and dozens of things, those who can afford. And it did affect the poor. It did affect the people in care homes, the elderly who could not do this. So I think the first wave and across Europe, and of course, also that when we see that, Europe, North America, actually the first wave, it's kind of swept through the populations, and very large numbers of people died in Europe, despite being the developed, so-called developed world. So I think, I think that, it's not that, I think and probably the mistake in India was that I think at that time, nobody knew what to do. So I think the developing countries, including India, we followed what Europe was doing. So we quickly introduced the lockdown when things were not so severe last year in March. And I think that itself aggravated. There could have been a much more measured way, because the cases were very low at that time, of actually moving people, making some arrangements for them, understanding the situation before doing a sort of sudden, with few hours notice lockdown. And I think, of course, later on, lockdown measures were being promoted, but probably in India, I think a lot of the distress could have been avoided if it had not happened so suddenly. Having said that, I mean, other countries which didn't put lockdown or pretended that everything is normal. So I also have a project working in Tanzania. And I think many of my Tanzanian colleagues are very worried that there are cases, but the government is pretending that there is nothing, and therefore not putting in place any kind of restrictive measures. So I think this has to be a careful balance between the health and economic livelihood, because if you kill off people by very sudden measures, that the solution almost becomes worse than the disease itself. And I think this was the main commentary in India in the first wave, that while COVID-19 was there, the solution was actually worse, or the policy response was worse than the problem itself. So I think that is something we need to be mindful about, given that we have already inequalities and already problems which exist.
Thank you.
Thank you. Then we have Dr. Mohammed Al-Hoshan from Syria.
Yes, thank you very much. Thank you for your presentation. Is very informative with the information. So I have one question. Based on your information, I think now we are under risk, all of us. So how can you see the future if the pandemic continue to for a long time, and what could we do to decrease these negative effects? Thank you very much.
I think that's a tough, that's an interesting question, but a difficult question. I think what the World Health Organization is saying is that we now know, one thing is, of course, the vaccines, that, we have to ensure that more people are vaccinated globally as one way to mitigate the impacts. It's not that the infection will go away, because they have also announced that maybe this coronavirus is going to be endemic. So like flu or like other virus, it will continue. But we have to learn to, therefore, better handle it from globally and collectively. I think the need for a global response is very important. But at the same time, in terms of vaccination and sharing of vaccinations, I think the WHO DG, even yesterday or day before, has said that before Europe starts giving booster doses, all other countries' vaccine should be made available, and so on. So that's one side of it. I think the second side of it is really that how do we, if we assume that this pandemic or other kinds of crises are going to continue, how do we, basic food and nutrition security is a basic human right of people. We cannot survive if we don't have food. So it's a right to food as well. How do we then develop strategies which are context specific? And I think this was my last point, that sometimes global solutions may not work, but in each area, depending on the local culture, depending on your own traditions and practices that people had, in a lot of the Middle East and North Africa, there's a lot of culture of sharing food, for instance. Even West Africa, when I went to Nigeria, or Senegal, people will eat from one pot. Whatever they have will be shared. I think those kinds of practices, which were community-based practices of storing local food, of, drying, for instance, supposing you can't get fresh vegetables. In India, there was a practice, I remember from my grandmother's time, where extra vegetables and so on will be sun-dried and then stored for the rainy season or for the season when these vegetables are not available, and then they will be used. So we had a lot of practices in different cultures. There are different practices. And unfortunately, because of globalization, everybody became crazy about some standard supermarket kind of thing. And I think what the pandemic has really taught us is that with global instability in prices, global supply chains are unstable, we really have to also look at what can we do within each context to ensure maximum food and nutrition security. And I think this really puts the attention when we put nutrition into the picture. I think especially for perishables, that is fruits, vegetables, from micronutrients, from where we get micronutrients. I think milk, we have to think about much more localized territorial solutions rather than being dependent only on long supply chains. So this is a big shift for many countries which are dependent on exports and imports, particularly in Africa, where many countries are commodity exporting countries, cocoa, beans, pineapples, and then they import everything else. So for such countries, I think it really has raised a policy question into how do you diversify your own production system to ensure that basic food security you can provide to your population.
Thank you. I just wanted to add and provide. Thank you. Some publicity for some work that Professor Narendra Shah had done. He has actually worked on solar dryers, I think, and I think those, and also for this cold storage, energy efficient cold storage. So I think those kind of technologies, low cost with renewable energy, will really be of use in these kinds of situations going into the future, so that locally produced food, like you mentioned, can be stored for a longer time and be used during times of crisis.
Can I come in?
Yeah, please come in.
Thank you, Professor Parsati, for raising that very important issue. In fact, today there is a set of presentations after 4 o'clock because we have extended this time by half an hour. Yeah. Today and tomorrow, we are actually showing cases of food processing. So you can store food, you can dry food, you can process it without ultra processing it. So I'm very sure that participants from many countries will find that this is something useful. And in that context, I just wanted to raise one concept that can we look at, instead of saying globalization versus tradition, can we say global standards, but local solutions? I think that is, so what happens is sometimes I may just say something is traditional, and you may keep telling me it is traditional, but you are not able to give, let us say, zinc to the child. So zinc to the child has nothing to do with global or local. It's a global standard. How do I provide the zinc will be the local solution. So I think in the pandemic and even after the pandemic, especially on the second day, we had 2 experts who told us, don't use the term post-pandemic world in a hurry. We may be, it may take some time, but I think we probably need to learn this, that how do we meet the globally decided standard? Okay, so this much calorie to a person, this much protein to a person, these are the micronutrients, this is the livelihood that we meet, but the solutions have to keep becoming more local. I think that it's time to probably look at that concept. So any quick observations, and then we will move on.
So thank you, Satish, for that. In fact, I think this is also the role of researchers and academics like us. So I'm engaged in a project now in Jharkhand, actually, where precisely we are looking at their locally available foods and traditional recipes, but we have got on board a set of nutritionists who are helping to analyze these recipes and tell us that, what does it contain and what is it lacking in. So I think that is in a way the building block. So then we can use that and then get into discussion with these communities that this is what you're lacking, and this is the way you can achieve it. And sometimes tweaking of traditional recipes is much easier than bringing something totally top down and new, because it is also a question of tastes and preferences of people. So I totally agree with you. I think this is also the pathway for us as academics, and our responsibility to try and match the local with the global standards, as you said.
Thank you so much.
May I add something, Dr.
Yes, please go ahead.
I just want to add a comment to what Madam Rao has just said, that, in Maharashtra, for example, we have worked on traditional recipes that are consumed by different communities of our state. And we have tried to determine the nutritional value of each of these recipes and shared this information on our website, so that more and more researchers and others who are working on this topic can understand that how we are trying to bring this information into the public domain. And therefore, many of these local traditional ways of cooking actually are very helpful in a disaster situation. And even otherwise, in normal times, in peace times, building the immunity levels of the community.
Thank you. Yeah, we have time for another couple of questions, maybe, or comments. Please do remember to unmute before you ask a question. Yeah, while maybe somebody is asking a question, a general comment, this is, I think you mentioned the elderly, and usually when we talk about the vulnerable, we talk about women and children, but the elderly, and we've seen this during disaster situations around the world, even in Europe, in Japan, in France, in the US, and of course in developing countries, the elderly are sort of socially excluded from many schemes, and they are much more vulnerable during disasters, and they're also equally vulnerable to food and nutrition security. So I just wanted to know whether there is any significant policy initiative addressing the needs of the elderly when it comes to food security during the pandemic or disasters.
So, Partha, I think that's why I think that is really a very vulnerable community.
Yeah.
And I think, like in the UK, for instance, I think the whole situation of care homes of the elderly has been, much discussed. I think apart from the social isolation, I think one was the UK, the one good thing that they did is for the above 80s, they made home delivery right from the beginning of the pandemic. So many of the supermarkets, that Tesco's and Sainsbury's and so on, they prioritize the home delivery, weekly home delivery to the elderly who are living in their homes, but also to care homes. So to that extent, I think they did have access to the basic food and nutrition in the developed countries. But I think there the social isolation, nobody can visit, they can't go out, has led to other, like lot of mental health problems and a lot of other kinds of issues, which it has been very difficult to address. But about the elderly, I also want to say in India, where I was, in Chennai, when the prices went up of fruits and vegetables during the first lockdown, and everybody was cutting back on consumption. So, because you could not afford. So I think there in many homes, and especially in lower and middle class homes where the elderly stay with the earning members of the family, I think there was a real cutback in terms of deprivation, in terms of, what they could consume. They themselves felt that they are useless, but there was also less overall in the house, and everybody cut back. And of course, this has very badly affected also the health and nutrition security of the elderly. And we don't often talk about the elderly, but I was in another webinar where also the mental health, particularly of elderly, has been very badly affected. I think now across the board, we have evidence that children, because of school closures, their mental health has been affected. Women's mental health has been affected. So I think we have seen a lot of negative health consequences in general due to the various policy responses to this pandemic.
Yeah. And in fact, the National Disaster Management Act and the various guidelines specifically identify the elderly as vulnerable and at risk, but somehow not very well translated into policies along with women and children. Thank you. Any other question or comment? Yes, Sadish, you had something to, no.
Partha,
Yeah.
can I just say something, Professor Partha?
Yes, go ahead.
Yeah. Sorry, it is little bit sidetracked, but what Professor Nitya Rao said, it just prompted me to say, like the caretaker homes for elderly, it is as much sort of recognize the contribution, particularly in our societies, Asian societies. I don't know in Africa, but in Asian societies, it's and particularly Indian, I would say, societies, it's still not taken well in the social structure that vruddhashram, and you keep the parents in this, and it's looked down, and so this social dimension, either Professor Partha or Professor Nitya Rao, would you want to comment? Is it something good, or is it something that we need to sort of push through what we see? Because there is something what you call as a caretaker fatigue. If the elderly people live in the house, the younger sort of, the what you call children, how long they can sort of look after, 1 month, 2 months, 3 months, at the most a year. Then subsequently, it creates a social issue within this household. And therefore, the contribution of these caretaker homes is a good institutional thing, but, good and bad is all in a social structure. I don't know, Professor Partha or Professor Nitya Rao, if you want to make a...
Just a moment before, because we are running out of time. I thought I'll just ask Miss Hind Ali. She has been having her camera on, whether she wants to ask a question. Otherwise, we can take up this response. Do you have a question, Miss Hind Ali? Okay, I don't think so. All right, then you can just take up, respond to this.
I think that's a separate discussion, but I think that, you're right. And I think this is one area where I see a class difference actually playing out. Because in India, for instance, you mentioned now there are a lot of facilities, and I know in South India for the elderly, for parents, and many children who are abroad or in other places are keeping their parents in these facilities, which are well taken care of, and, which provide a good atmosphere, which provide a social life and a social engagement, healthcare, and other essential services to the elderly. But I think this is where the social divide comes in, because I think, so amongst the elites or the middle class, the attitude is changing. I think the inequality in terms of the poor, if you look at poor with vruddhashram, they're in very bad shape, where, unhygienic, where these elderly people, even proper bath, cutting nails, nothing is done. They can be prone to infections. So I think we really need to, in our society, I think it's not about only the attitude towards elderly, but I think it's the class and caste difference of affordability of these systems. I can just say from China, I read very interesting that China has the same problem of aging population, worse than India actually. And now in China, unlike earlier, there is not that much of social security benefit, though they have introduced recently a universal pensions. But this universal pension is not enough to pay for a good quality private care home. So the children who are abroad in the US, they can afford to send their father or mother to a good private care home, but the rest of them are in a very bad shape. So I think there is both supply and demand here. One is the if good quality facilities which give you respect and dignity are there, I think people's attitudes will change. But if you have horrible facilities, then the attitude also will not change. So I think it's also a question of supply in this context.
Thank you so much. We are out of time, so we need to end this. So I would like to thank Professor Nitya Rao, as well as all of those of you who asked questions and gave comments. I'm sure this will be of value to each of you going forward in your own tasks and roles and responsibilities. Thank you again, all of you. So I also need to go now, and I think Professor Nitya Rao also has to leave for another meeting. So I would like to request Ms. Kushbu to present, but I would also like to request Professor Amit Arora to take over as chair now.
Thank you very much,
Thank you.
Partha, and thank you to everybody.
We can't hear you, Amit.
Sorry, I was muted.
Thank you too
very
from
much,
my
Professor Rao,
Yeah,
Sujata
thank you.
ma'am, Professor Partha, everybody. I think it was a very, very interesting session for all of us. We learned so much, I would say, worth spending a couple of weeks on this particular topic, which we learned in a couple of hours. So very, very useful, I'm sure. It's very useful for all the participants as well. So on behalf of our team, we really thank moderator, our Professor Dr. Parsarthi, and our speakers. Thank you very much once more. So participants, I hope you are understanding that we will have a little bit of an extension in this session. We will have actually one best practice presentation today. Before that, what we have planned is we will also give you an overview of what is happening in literature, in recent literature. So a quick survey of that literature will be presented by one of our students, Khushbu. She will take only 5 minutes to summarize what is happening recently in this particular area, which we have been discussing in the last couple of hours. So Khushbu, over to you. You may want to present a few slides.
Yeah, can everybody see my screen?
Yeah, and you can restrict yourself to say 5-6 minutes of presentation.
Yeah.
Okay, thank you.
Yeah, and just okay. Good evening, everybody. So I will just give a quick lowdown on the food security and nutrition security in the aftermath of disaster and conflicts, with a specific focus on Asia and Africa. Now, food security, insecurity, as all of us know, has been among the leading public health challenges in the country, even during peaceful times. The disruption of transportation, food supply chain, and other related aspects in aftermath of conflicts and disasters only further aggravate these problems. The State of Food and Nutrition in the World 2021 report estimates that up to 811 million people went hungry last year as climate extreme and economic lockdowns ensued in the result of in the wake of the pandemic. A review of the literature reveals. So I will first focus on the Indian studies and then Asian focused studies and then move on to Africa. So utilizing the Center for Monitoring Indian Economy's consumer pyramids data for 2019-2020 for 4 backward districts, namely Maharajganj, Munger, Kandhamal, and Kalahandi, Gupta et al. Concluded that there was a decline in dietary diversity for women, particularly for non-staple foods. So if women were consuming previously 5.04 food groups in 24 hours, in the last 24 hours in 2019, that came down to 4.66 food groups in 2020. Similarly, in another rapid telephonic survey of 448 vegetable farmers in 4 states in India, namely Jharkhand, Assam, Andhra Pradesh, Karnataka, it was found that female farmers were more likely than their male counterparts to report a reduction in consumption of vegetables, fruits, dairy items, and this effect continued to persist even if they accounted for other factors like the size of the farm and the kind of aid that was being provided and those kind of factors. So these kind of gender differences continued to persist. Similarly, in another survey of 212 households in Bangladesh, of both rural and urban households, it was once again found that as many as 90% of Soviet households reported a decline in their food security, but it was found that this decline was much larger in context of urban areas than in context of rural areas. Moving on to different countries in Africa, I have very country-specific evidence here. So in context of Nigeria, it was found that the impact of food security and labor market participation was quite extensive, where states which had reported doubling of COVID-19 cases predicted as much as a 3 percentage point increase in the likelihood of average household running out of food or having skipped meals in last 30 days. Similarly, lockdowns on the other hand predicted an increase in the likelihoods of households having skipped meals by as much as 15 percentage points. So both the COVID-19 as well as the mitigation strategies ended up having substantial impact on their food security. In another online survey conducted in Kenya and Uganda, Canciame et al. Reported that change in dietary patterns and using of past savings were one of the dominant coping mechanisms to deal with income shocks of COVID-19, which once again has implications for food security. The other last study, which talks about the systematic review of, like, basically which looks at all the studies which were major studies conducted on impact of COVID-19 on food security, reported that the food security, the impact on food consumption and food security for was substantial, but gender differences were also equally important, where females were more likely than males to have suffered the adverse impact of these kind of lockdown measures as well as the pandemic as a whole. Now, specifically coming to Africa, Messer et al. Reported that mean food production declined by 12.3% on a yearly basis. So every year it declined by 12.3% in 14 sub-Saharan African countries during each year of war between 1970 to 1994. So every conflict resulted in as much as a 10% decline in the food production. In another causal analysis of the impact of conflict on dietary diversity in Côte d'Ivoire, Dublin and Paul revealed that food security declined at a higher rate for households consisting of teenagers and adult female members, which means that once again, females were disproportionately bearing the burden of like all kinds of disasters or bearing the burden of any kind of conflict. Even after controlling for the potential impact of food, aid, and farm households, which means households which had own access to their food and all of it, the food security continued to remain, and therefore that became a major problem. Tusime et al. In context of northern Uganda also concludes that while the overall impact of World Food Program was positive, net the impact of World Food Program was positive in conflict-affected households of northern Uganda, but the impact was largely driven by male-headed households, which means female-headed households did not benefit as much as a result of these programs. The World Food Program maybe needs to design more different strategies while addressing the female-headed households. Lastly, talking about the implications for relief work, I will only focus on two studies. The Beisinger et al. Study of 2008 concludes that most of the relief measures pertaining to floods in Yemen focused on areas which are directly affected by floods, but the impact of the flood was felt by places which are located much further from immediate, like from ground zero, and therefore food security programs need to be designed in a manner that they are able to cater to these populations which may not be directly impacted by these disasters. DevRex 2007, on the other hand, uses Sense entitlement approach to classify policy responses across different domains in order to help policymakers make a more informed judgment in terms of the kind of policy responses which need to be undertaken in wake of different kinds of problems. As ma'am had suggested, like sometimes we focus more on the provision of aid and ignore things like creation of employment and provision of input subsidy or creating pricing controls and all of it. So yeah, that's about it. Thank you.
Thank you very much, Khushbu. I think that gives a quick summary of what academic world is doing in relation to the topic that we have been discussing. Now, I would like to invite Professor Vishal Sadish Pandey. This is in regard to best practices presentation that we had decided. And so Professor Vishal Sadish Pandey, as Professor Nitya Rao was mentioning, and also Professor Agnihotri connected this, he was saying that when you're looking at global standards, it would be apt to have local solutions available, right? So with that context, if you look at it, I mean, what Professor Vishal is bringing on board is connecting, his expertise in rural enterprise, in energy, renewable energy, together, and see how we can solve these pressing problems during this pandemic era. And of course, you will also see implications of the post-pandemic world. So with much happiness, I would like to invite Professor Vishal Sadish Pandey. And just give a quick, I don't have a written bio for him, but I'll just mention that Professor Sadish Pandey is an adjunct associate professor at Sitara IIT Bombay. He is alumnus of IIT Bombay in energy science area, and he has vast experience of both theory and practice. And I'm sure he will take you through that journey in next 15-20 minutes. Thank you. You are muted, Professor Sadish Pandey.
Thank you, Amit. And thank you, Professor Agnihotri, for this opportunity. Let me share my presentation. As Amit mentioned, I work as an adjunct professor in Sitara from 2013. And from last 3-4 years, I have a startup company called Survive Solutions, which is basically looking at empowering society through alternative technology. And the title of my topic is Small is Possible. It's basically inspired from Schumacher, who has written a book, Small is Beautiful. I teach that subject called Appropriate Technology. And I try to practice on a similar line where I am developing technologies which are useful, which are local, and which are high-end also. So I'll be talking to you about 3 technologies which are developed and which are actually used in the field, and I am promoting them through my startup company called Survive Solution. Survive means, it's a Sanskrit word, Survive means for everybody, and that's what we are building solutions for everybody. Okay. So I'll be talking to you about Jaggery processing, turmeric processing, and drying. These are the 3 technologies which we have evolved over the time. Jaggery is something which I am working from a very long time, and I could able to crack this in last 3-4 years. As you all know, Jaggery is a condensed form of sugarcane juice for all practical purposes, and it has a very high nutritional value. The process of Jaggery making is pretty simple. You extract the juice, you evaporate water out of the juice, and then the syrup, you cool it and you mold it, and you get the chunks and the mold of Jaggery. It's a typical farm level activity which is associated with the farming. And if farmer does Jaggery processing, he will increase in his income by 2 to 3 times. That's what the typical practice is. What has happened is last 100 years, 70 to 80 years, sugar is introduced in an organized manner, and in India, the sugar processing plants have populated, and somehow this sector, if you see in last 50 to 70 years, started declining. This used to be a village level or a farm level activity, a small business, which is in a dying state. So if we look at Jaggery from the nutritional point of view, so before that, okay, just I was, as I'm presenting to this international audience, I thought let me include the word which is, the typical participants from different countries will come to know. It's called panila in Central America and South America. Sukuri Nahuru is in Swahili. Hakuru in Sihila in Sri Lanka, and in Malay language it's called Gula Melaka. So these are the names, and these are some of the international Jaggery packets I have just presented over here. Okay. So if you see the whole process from farm level to the market, it goes through variety of things like sugarcane farm, then cutting, then loading, transportation, unloading, and then there is a processing and packaging and transport to the market and trading in the market. So this is the traditional way the whole value chain of the Jaggery is carried out. And there are different stakeholders involved at different stage. Okay, the stakeholders are farmer, cutting laborers, transporter, plant labor, then the plant labor, plant owner, then transporter, and the trader. This is how it is practiced traditionally, and my primary focus area is basically processing, where I attempted to intervene and develop technology. Now, if you see, this is a very general slide, which is just giving you some comparison. This is available on the net. You can look at the reference. It's basically, as compared to sugar, it's not an empty sugar. It has certain values, certain characteristics, and it is useful in a certain way for our body. If we drill down this with certain numbers, what we will see is this. So it contains sucrose, it contains glucose, it's actually glucose and fructose. So this glucose and fructose is called as reducing sugars, and sucrose is purely pure sugar or sucrose. Then it has a water, then all other things, out of which this iron is something which is very important apart from other things, which we find that it is not available in sugar, because sugar is a complete whitewash. It's you literally wash the sugarcane juice and you get the white crystal. Objective is to get the white crystal. But that, compared to that, jaggery is more of a physical process where certain chemistry is involved, but it is more of removing impurities which are present in the sugarcane juice in the physical form. The typical impurities are small bagasse particles, the waxes on the sugarcane, the fungus which is generally there on the sugarcane surface. So there are certain dissolved and undissolved impurities, and these are removed with addition of certain natural flow cooling agents, and some amount of lime is added, so that at a particular pH level, which is of the order of 6 to 6.5, you get the effective removal of all these impurities. And if you continue evaporating sugarcane juice, you will get a syrup which gets solidifies and called as jaggery. Now, the another important thing in the jaggery is it can be made in the form of the lumps, but it can also be nowadays made in the form of powder and chunks, which is very easy to consume, particularly powder, because it is very compatible with the sugar. Okay, now just to give you a simple comparison, if you see the source of iron from different products, and out of this product, you will find the jaggery contains around 8 to 11% of iron milligrams per 100 grams. So as compared to this, if you do some back of the envelope calculation, you will come to know that this is one of the low cost source of iron. And typically our body requires this kind of iron in different stages, and particularly in India, and I hope in all the other parts of the world also, the practice of feeding iron rich food to pregnant women and lactating mothers is a part and parcel of all the cultures. And you will find that jaggery plays a very important role. In India, we have typically this kind of jaggery bombs. It's actually a laddu in local language, jaggery balls, where these are enriched with dry fruits and jaggery, which is actually very useful for providing the iron deficiency in pregnancy and post-pregnancy during the lactation period. Okay, so what is happening in the country? Now, jaggery is produced everywhere in the world. India is one of the leading producer along with the Brazil. And in many African countries and in Southeast Asia, jaggery is produced. In India, we call it as it's a crop of a lazy person, because you really don't need to do anything. You have to just water this crop when you cultivate it, and that's all. It will keep on growing. It's a variety of a bamboo, specialized variety of the bamboo. So people, actually farmers like this, and they would like to sell. But what has happened over the period is there are a lot of related things like local politics, sugar mills, cooperatives. So it's very difficult for in many areas in the country where farmer can't sell his crop effectively to sugarcane, or he may not, sugar industries, or he may not get the right price or the money at the right time, or the full money. So many people are now started looking at Jaggery as a viable option. This is a data of 2014-15, where the typical Jaggery production is 15%. The sugarcane consumption for Jaggery production is typically 15%. And if you do just a backup envelope calculation, you will find here that Indians consume roughly around 3.7 kg of Jaggery, and they also consume typically around 17 to 18 kg of white sugar. Now, if I do this calculation, it will come to somewhere around 4.81 lakh or 0.48 million tons of Jaggery, which if I estimate the typical Jaggery processing plant is 10 TCD and operates for 150 days, we will get in the country somewhere around 25 to 30,000 of Jaggery processing plants. So this is the quantum of processing we are talking in the country. So what is happening with this plant? Now, if you see this plant, and if I take you to the plant, I don't think any of you will eat this Jaggery, because there are a lot of things which are happening in this processing. They are processing it traditionally, but it's a very, very unhygienic operation. There is so the first thing is there is a challenge for, as I just told you, sugarcane factories are not paying on time to the farmers. And then the challenging in the Jaggery processing is unhygienic operations, very, very primitive technology in terms of, you have to just pan, and it's like a big chula or a big kind of stove. Then there is a labor and space intensive operation where you actually need a skilled labor. You need a process expert. And this skill is acquired over the time, or it may be acquired through family. Now, this skill is like a master chef. Now, the skill is important to get the right kind of crystallization of the Jaggery, and the Jaggery which can have a good shelf life. Then the other thing is they are using a lot of harmful chemicals, particularly sulfur-related chemicals, which bleach the Jaggery. And there are so many other chemicals which are used for cleansing of the sugarcane juice. Now, these chemicals are not used in a controlled manner, and few of them or many of them are carcinogenic. So if at all you also buy Jaggery, which has high nutritional value in terms of iron, but it may not be giving you a good quality because you are taking iron, but the Jaggery is adulterated with the chemicals which is used in the processing. And the last and not least is the consistent quality. As there is a human intervention which is done by the process expert, there is a reasonable amount of inconsistency in terms of the quality, form, output, shelf life, and variety of other things. So what we did, so this project I took up somewhere around, I started my work in 2006 when I was working in a corporate, and I kept on working on my weekends. I had filed a patent and granted a patent in India. And eventually, in last 3-4 years, when I left corporate, I started working on this, developed the R&D plant in 2018, where we could able to produce a very good quality Jaggery without adding any chemical, using natural flocculating agent and lime, only these two ingredients. And then we commercialized this unit. We have now 3 installations, and 4th installation is in progress. So what is this plant? Now you can see the plant on the right side. I will show you a small video which will give you, the kind of plant which was installed at Kolhapur. Have a look at it. Okay, so this is the key aspects, attributes of the plant. It is already shown. One of the things I would like to just elaborate that it is a very compact plant, and it brings what I feel, it brings a kind of a discipline of industry, which is much beyond technology and what we all see. Typically, when we go to rural areas from Sitara, people are becoming educated. The younger generation is becoming more educated. And if you ask them, guys, would you like to do the farming? Then they are very shy of, or they may not be interested in continuing their farming profession. But if you ask them, you will be interested in polyhouse or more kind of protective farming in net shade, shed net or polyhouse, people are excited about it. So one of the things what comes here is kind of a standardized, glamorous aspect of processing, and that's what we are trying to offer over here. Because this plant, we are calling it as a Jaggery processing plant, but in a way it's a small food processing plant, and it has all the aspects of a big industry which will have, where the controls, consistency, then computerized operations, data driven operations and all that. Okay, so this is about Jaggery processing. I would like to talk to you about turmeric processing. Amit, hope I have 10 minutes more.
If you can wrap it up in 5 minutes, nothing like it, but yeah, I mean, try to finish up.
Can I suggest something?
Yes, sir.
Yeah.
I think we are looking at now, we looked at a lot of issues of food security, but we are looking at practical solutions, which other participants from other countries also will find interesting. So if Professor Vishal could continue tomorrow, I think that will be helpful, because that will do justice both to the topic and to the participants. So what we can do is on Jaggery, if people have any question, because there will be many countries where this is grown, because doing it in 5 minutes for turmeric, I mean, if Professor Vishal is okay with it, I don't mind, but then at least dryer he should do tomorrow, because dryer will have a much larger interest.
Yes, sir. In fact, turmeric and dryer can be done tomorrow together. I can address Jaggery questions if they are, because I have made it very short,
Yes.
Yeah.
So Vishal, tomorrow in the second half, we will have all best practice presentations. So that will gel well with that.
Sure, Amit. No problem. So I'll start from turmeric and continue turmeric and dryer.
Absolutely.
And I'll be happy to take questions for 5 minutes.
Sure.
If somebody is interested.
Yeah, participants, you have any questions, please unmute yourself and feel free to ask. You can also put up your questions in chat if you wish. So while participants are preparing themselves, as I think, to ask questions, I think one question that may be in relevance with all these countries. So Vishal, you may be aware that these countries may also have something very specific, raw materials or, so to speak, substrates that can be converted into highly useful products. So while you are going to talk about turmeric and dryer, I think the larger context, if you can give to them, that how in their countries with their raw materials, what can be offered, in terms of erecting a rural enterprise that can give employment and value generation. I think that will be really, really useful.
Sure. Okay. So what really we did in Jaggery, if you see, the traditional process of Jaggery making has a lot of inconsistencies and lack of standardization. So in your specific countries, you may have some traditional methods of processing variety of things. And with this Jaggery case, what we learn is basically there are certain ways in which A, you can standardize the process, B, you can associate or you can connect that process to instrumentation, some kind of monitoring. Okay. Third thing, you can introduce a lot of automation, which is essentially for low-cost automation, which is reducing drudgery, which is improving hygiene, which is improving footprint, which is facilitating fabrication or manufacturing in more organized manner, so that what happens is the hassles in any technology will reduce to a substantial extent. Because you will find the traditional Jaggery technology is where the owner has to organize a pan, organize bricks, he has to build a small stove and then put the pan onto it. So these are very localized way of doing things. In olden days, there used to be a very devoted people who will do it, and they will be kind of a process expert, and they are kind of married to this whole concept. But now with the globalization, industrialization, people are moving, the younger generation is not interested. So we need to look at our traditional technologies, how to conserve them, how to uplift them. Now, as I mentioned in my talk about Schumacher, who has given the concept of small is beautiful, it's very beautifully said by Schumacher. There is a $1 technology, which is our traditional technology, which is essentially evolved with the human being in terms of, they felt need and they kept on building something, which is your traditional Jaggery plant. And there is a $1,000 technology, which is a sugar processing mill, which is very organized, which is massive, and which is a big scale. Now, what Schumacher explains, there is an ample scope of developing a technology which is in the range of $10 to $100. Now, what this $10 to $100 technology is essentially it will take up the $1 technology and try to implement the $1,000 technology aspects to this $1 technology and develop the intermediate or appropriate technology which can be used by people in a more organized manner. Okay, so I will stop here, and I may continue tomorrow for 10 minutes and take you through the turmeric and drying session. Bye. Any questions? If you want on Jaggery or tomorrow also, I can give.
Yeah, thank you very much, Professor Vishal. So if there are no more questions, I think we have reached to end of our session today.
There is one question in chat, Amit.
There are questions?
There is one question I could see.
Okay, so you may want to answer. It's like solar heating could be included.
Yeah, so I'll just tell in 1 minute and then.
Sure, please.
Yeah. So so the thing is, the capacity of heating of Jaggery is very high, and the fuel which we use in the Jaggery processing is a biomass, which is a thrash which is left out, which is called as bagasse after crushing of sugarcane. So heating with solar is technically possible, but it may not be a cost-effective proposition, or it may not be a very attractive proposition. So it is not generally practiced, but technically it is possible. Economically, it may not be possible. Okay, Amit,
is there any other question participants may have? Okay, looks like everybody is satisfied. Of course, I mean, we understand today it was a little longer session, but I think we had very eminent speakers talking about disaster, and then understanding these conflict and war situations and how food and nutrition security was seen. Even the gender lens were also given by Professor Nitya Rao. And then after that, Professor Vishal Sadish Pandey presented, what are the possibilities in this pandemic era, how to connect, how to make a rural enterprise, which is not really considered a sophisticated one, can be actually transformed into something that, which attracts attention of people and they would like to work on that. So it's very similar to the actual food processing plant, sophisticated plant, but not to that, costing basically. So it's a very great attempt that Professor Vishal Sadish Pandey has shown, and we will continue to see more cases tomorrow after first presentation. I think we'll have about 3 to 4 best practice presentation from India IIT Bombay side. And if somebody wants to share anything from your side, participants, feel free to let us know. So we would like to incorporate that as well if possible for tomorrow. Thank you very much. Professor Agnihotri, have any anything else to add today?
No, not really. Just to mention to the participants that now we are moving towards the larger issues like conflict, disaster situation. Tomorrow we will look at policy challenges. At the same time, we are also moving towards what do we do locally. I think both these are important. So today, these 2-3 best practices that we showed, tomorrow 3-4 which we are showing. We hope that there will be interest in the member countries also, and probably through AARDO's support, we will be able to exchange the knowledge or practice on this important issue. So I think with that, we can close for the day. Professor Amit?
Yeah, sure. I just want to have one more thing to say to participants. Now, participants have seen some of the best practice presentations. So if you have some raw materials or some underutilized fruits or vegetables, in mind, in your country, which is plentifully available, but there is no value addition happening, I think you can bring in on board. We can discuss those things here. You can start discussing that in this forum, and then we can see in maybe, we can discuss with AARDO whether there is a possibility of taking that up also in future. Right. So it's good to review that in your own country, what is available and what value addition is possible. So we'll all can figure out if there is any possibility of value addition.
And one last point to all the participants, I hope you have formed your country teams and you have decided who will present on the last day. You can nominate any one person. We will actually be circulating to you the sequence in which different countries will make presentation. So again, we will not go alphabetically, so we will go one end ABCD and the other end XYZ. So of course, Bangladesh will come first, then probably Zambia, and we will go in that order. So participants, please form your team, discuss together, and you can have one person or two persons who can present your country's view on the last day. So we will be making this request on WhatsApp and mail also, but please, among yourselves, you decide one person to present. Thank you very much.
Thank you, sir.
Thank you.
Thank you very much. I think that ends the session today. We see you tomorrow afternoon, 2 o'clock Indian Standard Time. Thank you, everyone.